Okay, welcome to the first PR News LinkedIn Live chat of 2021. Again, the rules are the same. We'd love to have your questions, so please send in your questions for our honored guest. A little intro to the topic and who he is. It's not news, of course, that our country is divided on several things, including politics, obviously, but also on the threat of COVID-19 and on the importance of getting vaccinated. Ironically, and we did not choose it this way, but today, on this date, January 13, 1 year ago, was the first case of coronavirus outside of China. That was this was the first day that one outside of China was found. According to the World Health Organization, the 7-day average of daily new cases hit a record high of 715,000 on Monday, after new cases had surpassed 800,000 in 2 of the past 4 days. As of yesterday, January 12th, the World Health Organization reports that more than 89 million cases of COVID-19 globally, including 1.94 million deaths, have been reported. With more than 22 million cases here in the United States and 376,000 deaths, the U.S. has been the worst affected country by far. So depending on the poll you look at, though, only about 50 to 60% of U.S. adults trusts the COVID-19 vaccines. In general, trust is higher with older people and is lower within the Black and brown communities, which seems reasonable for a variety of reasons, which we'll get into. And of course, there are some people who don't believe the virus is a threat to them. Will they get vaccinated? And we'll ask our guest, do they need to? Now, how did we get here, and what can communicators do to move forward? On this very, very important topic, I'm joined by my colleague, Nicole Schumann, and our guest is one of the foremost healthcare communicators in the PR space, and that's Gil Bashe, who's the managing director of the global health practice for Fin Partners. Welcome, Gil.
Thank you, sir. Thank you, Nicole.
Yeah, Nicole, why don't you start off with a question?
Sure. So this week, we showed up that we wrote about vaccine distribution and messaging. And we're seeing now, especially after the new year, a lot of big organizations coming together to collaborate. The one that was launched just yesterday is called Because of This, and it is a campaign put together by Pfizer, a bunch of very important healthcare organizations, including the American Nurses Association, and 2 agencies, Denny von Muffling's Communications and No Fixed Address. And this campaign touches on a lot of real life moments that we can look at these moments, and hopefully people will find a camaraderie with them, and hopefully we can get back to these moments through large scale vaccination. And 4 PSAs were launched, including a small short piece on hugs, hanging out with family, things like delivering special messages in person, like maybe like you're going to be a grandma or a grandpa, or we're getting married, or a new job, different things like that. So things that really happen to people, on a daily basis in our lives that a lot of us are missing out on, that one-on-one communication in person. So the collaboration is real key here. Absolutely. And hearing what's, one of the ways that they communicated, and I'll put the piece up in a second. One of the things that they wanted to communicate that these ideas came from the healthcare workers that they collaborated with, that they wanted to showcase these real life moments and create a message from there. So, Gil, you've taken a look at some of these. How do you think they are, and how they put this together?
Yeah. So Nicole, first of all, it's a great question, and it's a beautiful campaign. It's very touching. The sense of a senior citizen with seeing their grandchild for the first time. And sometimes we have to remember that the audience for these campaigns are not necessarily America. Sometimes the audience is the people who are facilitating this possibility. So for people who have been on the front lines so much and are now being asked to remain on the front lines, to be people, pharmacists, nurses, nurses assistants, healthcare practitioners, trained paraprofessionals who are giving the vaccinations, they need to know that they're being inspired as well, that they're reopening society. Will this campaign inspire Americans? I think Americans who want to be vaccinated are inspired by the fact that they've been more or less on lockdown now for close to 8 months. They don't need to be reminded. The people who are really in the forefront, in the trenches of making vaccination happen, they need to be reminded that they're making a vast difference in the world. And so I think the campaign beautifully appeals to them. And I think we're going to need a variety of different vehicles and campaigns to bring people in. What I hope we get to in this conversation is the fact that unless we begin to mobilize around a concerted message and voice about how to get vaccinated, where to get vaccinated, when to get vaccinated, who should get vaccinated, when they should get vaccinated, if we don't start to really deal with these fundamentals of the vaccination process, I think that what I wrote about some time ago and Seth and I discussed, which is the pandemic of chaos. We're creating a pandemic of communications disconnect with America right now. And I'll just end this moment with a comment, a practical comment, where New York State lists places where you can get vaccinated, pharmacies. On the behalf of our senior citizen in-laws, we called. And in 2 cases, both pharmacies had recordings. They never had vaccines in their pharmacy. They're being inundated with calls. They've never even had 1 dose of a COVID-19 vaccine on their location. They're being bombarded by anxious, not eager, anxious, they might be eager also, but certainly anxious US citizens. That's part of the communications process. I think what we have for the first time is not a breakdown in the supply chain of innovation. We have a breakdown in the supply chain of information. And that breakdown is actually creating a sense of paralysis in the American population when it comes to vaccination.
Gil, you've written that, based on what you just said, you've written that we're in we're living in the United States of COVID confusion. Let's not assign blame now, and let's not look too far back in this conversation. But briefly, how did we get here? And could better communication have helped reduce some of the confusion that you just mentioned?
Well, the answer to your second question is a quick absolutely, exclamation point.
Yeah.
The answer to the first question is very complex. And the reason it's so complex is people think, why can't our government get this right? Right? Isn't that what we're thinking without assigning blame? Why can't the government get it right?
Right.
But let's take a look at the government for a second. We have 50 governments in charge, actually 51 if we count the federal government.
Right.
We have 51 governments in charge of this program. Each state has a program. In New Jersey, there's 1A, 1B, and 1C. In New York State, it's 1, 2, and 3. So what is it? Like, are you number 1? Are you number 3? Are you 1A? Are you 1C? We have a variety of different state-by-state programs. That's 1. 2, we had yesterday HHS and CDC talking at each other, not in alignment, in disagreement. HHS says 65 plus. CDC says 75 plus. So we have a constant bombardment of national information that doesn't make sense. This is a little bit like my giving you a puzzle. You're being a puzzle putting together expert, and you open up the box and you say, holy mackerel, Gil, these puzzle pieces are from different puzzles. What do you want from me? We have the most fragmented health system in the world. And let me give you a juxtaposition to that. Our organization, our agency is also the largest health communicator in Israel. And Israel is being touted day in and day out as the first country in the world that will probably vaccinate its entire population by the end of March. I have friends already getting their second vaccination this week. Why? Everybody's in a health plan by law. Everybody's in that same health plan, probably from birth to death, generation to generation. Digital health systems, United Electronic Medical Records, they can schedule you by an app. They can direct you where to go. We don't have any of that here. How do you know even when you're supposed to show up, when your appointment is? Even if you are registered, where do you go? What time do you go? It's complete pandemonium.
Yeah. Okay. So the President of the United States, generic, brings you into the Oval Office.
Said, Seth. I love that, Seth.
Well, I mean, it's really not important who, but the leader of the country brings you in and says, Gil, what can communicators do to help here? We know, based on what you just said, I agree, we have a very fragmented system, and it's coming to the fore in at this moment. What do we do? What do you say?
I'll tackle that one for a second, Seth. Look, we know from good communications, it's all about consistent shared messaging. That's the basis of the problem. We don't have in this country right now any consistent shared message that is going out across the nation. Our media, if you think of CNN or Fox or MSNBC or ABC Nightly News or CBS Nightly News or PRNEWS, they're not state-by-state media. They're national media.
Right.
And so we have to understand, we have to communicate with a consistent voice. And this is a great example when you're dealing with a public health urgency, a pandemic. A pandemic doesn't know state borders. But suddenly our health policy is a state-by-state policy. I would recommend to our incoming Secretary of HHS, the generic Secretary of HHS, along with our Director of Infectious Disease at CDC, Dr. Anthony Fauci, to really pull together our 50 state health commissioners and governors in a quick conference call, agree to a make sense national program that is coded the same, whether it's 1, 2, 3 or ABC or by age group, and then work out the details. I also think that just as a Google or a Microsoft or an Amazon have mammoth project managers, this is a little bit like a massive public health effort. We need to bring in the supply chain management experts of supply chain applied to communication and start to get that right. Now, where do you go? When do you go? We need to use this as a vehicle to actually start to bring the American people into alignment with this public health initiative. So let me just summarize that. It's not dictating to the states. It is really bringing the state health commissioners and the governors or their representatives together with the Secretary of HHS and CDC and aligning on a program and the messaging around that program, and then the rollout of the program, looking at the stopgaps. And Seth, I just want to add something. Mm-hmm. The Pfizer CEO at JP Morgan announced today, I think he said something like, and please, I may not be 100% correct. I think he said something like they will have this year 2 billion doses by the end of 2021 available of their vaccine. Moderna said that they would have 400 million doses of their vaccine by the end of Q2 for America, for the United States. The challenge isn't in production. The challenge isn't in production. The challenge, again, is in information consistently applied across the citizens or residents of the United States.
Speaking about communication and information, Gil, a couple of questions. What is a bigger worry? What's the biggest worry at this point, from your point of view, around the vaccination? And B, what about people who don't believe that the coronavirus is a threat to them and won't get vaccinated? And do they need to? For example, let's say 90% of your workforce. Let's bring it home to companies. 90% of my workforce has been vaccinated in my office. So I've got 10% of the people who don't want to be vaccinated. They're worried about it. Maybe they're protected. Maybe they're anti-vaxxers, whatever. Maybe they don't believe that they're going to ever catch coronavirus.
Yeah.
Do they need to be vaccinated?
Yeah.
There are two questions.
So Dr. Jeff Livingston, who is an OBGYN I think in Atlanta, Georgia, he's a very prominent author on Medium's Being Well publication, wrote something that I believe and I support, which is, look, economic systems drive progress and change. And Qantas made a very bold decision, I believe, this morning. If you're not vaccinated, you're not on a Qantas flight. Plain and simple. You're just not on a flight. And that sort of decision-making, the bold decision-making, may be necessary here, which is if you don't have, at a certain point, a vaccination card, you're not in this mall. You're not in this store. In some cases, it's being discussed right now by major employers. If you're not vaccinated by a certain date, you may not be part of our workforce. And this is a case where we have to understand that lives are on the line. We need to be respectful of people's right to make personal decisions for their households. We appreciate that. That's one of the great aspects of this nation, respecting people's liberties. But, it will take some bold, strong leadership. So what Dr. Livingston said is, it's about economics. I think he's right. I think Qantas has stepped into the fore and made a decision. I think other airlines will follow suit. I think that's the domino effect now, which is you're not vaccinated, you don't have a vaccine passport. Guess what? You're not welcome in the supermarket. You're not welcome in this mall. You're not welcome in this store. You're not welcome at this place of employment. And that's key. I will say that someone just popped on a question about maybe vaccination is part of a government conspiracy. Right. And we hear all these conspiracy theories constantly. Here it's up again, not part of a conspiracy, maybe a global government project. We're always going to have anti-vaxxers. We've always had anti-vaxxers. This is a time where the anti-vax movement started as admitted by false data that was published some years ago. The author of those data acknowledged in the end that they were false data. But as we've discovered as far back as World War II, if you tell a lie often enough, people will believe it, and that's part of this process. That's why I suggest we must align now. Our public health system, our government system must align around truths, scientific truths, and begin to work together. And then back to Nicole's question that led us off. That's why I think all these campaigns are beneficial. They're helpful. They're emotional. They speak to the different audiences. Nothing is wrong here. Nothing is wrong. It's all part of a big fabric. And it inspires people who are on the front lines to boot. But I think that at this point we need to have alignment. I think that the Pfizer CO and the Moderna CO are doing a wonderful job. I would suggest, as I just got off a conference call at JP Morgan, sponsored by STAT, moderated by Matt Herper, who did a beautiful job moderating with the inventors of the Pfizer BioNTech vaccine. They shared very interesting data about the sense of allergic reaction, anaphylactic reaction, and so forth, what they see, what they don't see. I think that these data need to be available to the public to address their concern. By the way, Seth, something you've been involved in, transparency. You're a believer in that. Nicole, you are, I am. Transparency will help this.
Yeah.
I had a question for Gil. I guess, and looking at this from a communicator standpoint, you mentioned some of these organizations that are, taking big stands with, making sure people are vaccinated. Say you're a communicator, in a school district, or if you're a communicator for a small business or a regional business, and you're in charge of getting information to employees right now, saying the government and its entities need to be more collaborative with healthcare organizations. where do you suggest communicators look to? And, for what types of information should they be dispersing to their audiences?
Nicole, that's such an important question. I want to add a point to what you've just said, because it's a critical statement beyond the question. Everybody who's listening in today, everybody who's a business owner, whether it's a small business owner, whether it's a school district superintendent, whether it's a mayor of a small village, whether it is the commissioner of health of a state or governor of a state or the president of the United States, we are all communicators. We are all role models. And when it comes to COVID, we're all part of the COVID-19 prevention effort. So the question you ask is hard. It connects to Seth's question, like, hey, the generic president of the United States, what would you do? So we're all president of the United States in a way when it comes to COVID. And that's a little bit of the problem we're facing right now. Everybody is their own little president. We have no centralized source of definitive information. So here's who I would say, I'm going to be a contrarian for a second. I would say everybody should actually go to the Moderna, don't please crash it, to the Moderna and Pfizer website and be tracking for this. One thing I've learned about drug innovation is no one knows more than a medication than the people who invented the medication itself. And that's a scary thought, but we also have to have good faith that that information, and it's vetted out by the Food and Drug Administration and other third-party medical experts. So anything a company like Pfizer posts or Moderna posts, or any other company, AstraZeneca, posts about their vaccine is vetted and vetted and vetted by regulatory bodies. Janet Woodcock, who's in charge of the FDA vaccine regulatory program, is a consummate public health professional, par excellence. Her people are looking through all of this. I would look to, quite honestly, someone who has not been heard of a lot, Janet Woodcock. I would look at what she's saying. I'd look to Pfizer and Moderna. And even though he's had to adapt, it's a moving target, COVID-19, I would actually listen still to Tony Fauci. I would listen to Dr. John White of WebMD. Again, this is a moving target, but I think John White is an authoritative source. And and there are some pundits out there who, I would say, if you're concerned and you want to have the yin and the yang, some people I follow out there, John Nosta, who's on Twitter. He's, I think, one of the world's greatest digital health sort of voices. He posts a lot of contrarian stuff. If you want to get the flip side, look at John Nosta. You're welcome to follow me also, but I would look at those people most certainly.
Gil, as we all do, that the Black and brown communities have been disproportionately whacked by this coronavirus for various reasons.
Let's call it racism.
Okay.
Let's call it systematic racism.
Yeah.
Right?
Yes. And one of the issues, and we see it in poll after poll, is the Black and brown communities are less inclined to be vaccinated. Members of those communities, for very good reasons, the Tuskegee experiments, Henrietta Lacks. I'm a communicator in a company, small, large, medium, whatever. A member of the Black or brown community comes in, and an employee says, I don't trust the vaccine. I don't trust the administration that brought it to the fore. What do you as a communicator do? Hopefully you're going to say, listen very carefully and not dismiss those.
Absolutely. Look, first of all, nobody's concerns, even the anti-vaxxer concerns, should be dismissed. Emotion influences decision. And so we have to start always, we talk about head, heart, and gut. I think you want to listen with your ears, but you want to process through your heart. And that's really important. And Seth, you mentioned a number of reasons, but and certainly historically going back to before World War II. But I'm actually going to say that a history of systematic racism, in other words, institutional racism, has not generated a tremendous amount of trust in the system. So that's basically it. There's a lot of conversation going on right now to appeal to ministers, places of worship, and so forth. That's not going to overcome these waves of mistrust. That's well deserved. So I think that to some extent, listening, providing more access to authoritative leaders. I think authoritative leaders need to go out into the community and listen and offer information. I do find that a lot of people are prescriptive, and you said something very important. Listening is not just sitting there and letting people talk. It's actually going out and asking tremendous amount of questions. And I think that we are losing time right now. We should be sending out people. We should be sending out people into the communities, speaking with thought leaders from those communities and people, residents in the communities, to find out what are the core concerns, and then getting their assistance to mobilize to address those core concerns. But again, I was on the phone a few weeks ago with the Minister of State, formerly the Minister of Health from Senegal. What came across in that conversation is, we're talking about the developed world and the developing world. This is a pandemic. We will not be safe until we are all safe. And in terms of people of color, the brown and black community, we will not be safe until all people in this nation are safe and cared for. And if that doesn't happen, we're not going to achieve our goal of protection from COVID-19.
Well, thanks, Gil. I wish we had more time to talk about this, because there's so much that we can touch on, and there's so much coming out right now. It's going to be an ongoing issue, obviously, even though, we crossed into 2021, it's still going, still raging, and hopefully we'll have more time again in the future to continue talking about this. And I hope everyone watching, please, keep going to prnewsonline.com, because we are always updating our information on this as best as we can, and trying to provide communicators with some guidance on how to get through this, unprecedented time and events. So, but we do have a lot to look forward to. I mean, there are good things happening.
Absolutely.
When you look at the differences from, March 2020, it is a world of difference, and they've done so much within a short amount of time. So really need to, give our thanks to the scientists and researchers and everyone that's been working on all of this, because it's truly amazing what they've been going.
Almost miraculous. I want to thank Nicole, you and Seth also. Your reporting around communications issues with COVID-19 and practical advice to communicators has been exceptional. So congratulations to you and the publication.
Well, thank you. We know it's important, so we're trying to keep that up for our viewers and our readers. So before we go, I just want to let everybody know there are a lot of great things happening with PR News in 2021. And one of the things that is happening currently is that we're taking some entries for our digital PR awards, which the deadline, I think our first entry deadline is February 19th. There we go. Put it up there. I'll share the link on LinkedIn as well. If you have, some great digital work that you want to showcase, now's a great time to do it. I feel like we've had a lot of brands do a lot of amazing things digitally this year. So, whether it's an event, whether it's a campaign, go for it. And, you could see yourself winning an award this year, which is a great way to start 2021. So again, thank you, Gil, for your time. We know you're
always a pleasure. Always a pleasure to be with you both.
Definitely appreciate it. And Seth, you as well. We have some great things coming up in 2021, and we wish the best for everybody watching at home, and for you as well, Gil. So take care and stay safe.
Thank you all.
Thank you.